my name is Melissa, and I decided to do my signature assignment on hormonal replacement therapy. The article I chose is Genistein Effects on Quality of Life and Depression Symptoms in Osteopenic Postmenopausal Women, and the article was published in September of 2013. So, estrogen deprivation has been held responsible for physical and psychological changes occurring during menopause. The scientists performed this study because studies on pure genistein from our research group have focused on cardiovascular outcomes, menopausal symptoms, bone health, and safety in osteopenia postmenopausal women. They wanted to see if taking the hormonal replacement therapy would benefit and improve their quality of life and decrease depression. So the exposure of hormonal replacement therapy has a connection to osteopenia experienced by the women that were selected for the study. However, the purpose of the study is to see by taking the hormonal replacement therapy will improve their quality of life and decrease depression. And since hormonal replacement therapy is known to put women at risk for cardiovascular diseases, breast cancer, etc., this also makes a connection. So basically, unlike most studies that are trying to see the benefits and the risk of taking hormone replacement therapy and the different diseases, like I mentioned, cardiovascular diseases and breast cancer, this study is just trying to see if it improves the quality of life. So their parameters for testing the quality of life are health status, life satisfaction, depression, and social interaction. So the study's hypothesis is the treatment of genistein has impact on health-related quality of life in osteopenic postmenopausal women. So the major techniques used in the study were a double-blind, randomized, placebo-controlled trial using isoflavin, genistein, 54 milligrams, or placebo for 2 years. In the trial, they selected 262 postmenopausal women aged 49 through 67 years. They measured the genistein plasma level at baseline, so at the beginning of the trial, before they started, after 1 year, and then a third time at 2 years. Then they measure the quality of life by using the Italian version of the short form 36 questionnaire and Zung self-rating depression scale at baseline, again at 1 year, and then at the end of the intervention period, which was 2 years. The results for this study were at 1 and 2 years for participants taking the placebo. Scores on all the areas of the questionnaire decreased. And then the participants taking genistein showed increases on all the areas of the questionnaire at the end of the study. And then at the 1 year, so at baseline they were equal, and then at 1 year they showed either the same or slightly above the placebo, and then at 2 years there was a huge significance. Overall, genistein improves the quality of life, including health status, life satisfaction, and depression, like I mentioned earlier. The results supported the hypothesis, and the article didn't say if they are going to further studies on this topic. So I chose this article to review because my mom and a lot of her friends are going through menopause and are either taking hormonal replacement therapy or torn between taking them. They always ask me if we learn about this in school because they know I'm in nursing school, and I always tell them that we know that there are risks, definitely. We know that there are risks for taking hormone replacement therapy, and there's a certain amount of years that they only want you to take it, but we don't really learn it in depth, and it's more knowing about the different studies that have been going on. So I know that this helps some women a lot, and but the risks involved can be scary. I was interested to see the quality of life, if the quality of life outweighed the risk of getting heart problems or cancer. So basically, I know that some people will take the risk if they know that it's going to benefit something. And for some people, having a healthier life, being more social, having decreased depression, that sounds more appealing than maybe you might get breast cancer or you might get cardiovascular disease. So some people want to take that risk because to them it's more important to have a better quality of life. So I thought that's what I really intrigued me when I was looking for different articles for this topic. Um, I thought that this article was well written. It was easy to follow. It wasn't confusing at all. Usually, articles can be really confusing, especially when it's not really explaining the statistical part of it, and the graphs that are showing and the numbers are just kind of thrown out there. So, researchers and other people that study it know how to read it, but not necessarily other people that just want to know. The only thing that I didn't really like is that it in the results there wasn't more information on the different sections in the questionnaire that they asked, and the result section was shorter. So they mentioned that the genocide improved the quality of life, but they didn't really elaborate on that, and I wanted to know more about that. I was really interested in knowing that. Overall, like I said, I really enjoyed the article. It wasn't my favorite article. It wasn't the best article I read either, but in terms of being easy to follow and the topic itself was really interesting. So, in the discussion of the article by the author, there are a few studies assessing effects of hormone replacement therapy on quality of life in postmenopausal women. Most of these show a positive effect of estrogen supplements on various parameters of quality of life, but controversy surrounding many women stopping treatment. On the other hand, ginseng has been proved as a molecule with a good safety profile. In fact, 3-year data in postmenopausal women are in disagreement with most of the other studies in the literature that show no benefit from the soy isoflavone supplements over the placebo. And then other studies that have been done on this topic didn't get the positive results that this study found. According to Amato et al., it also did not show any improvement in the quality of life in postmenopausal women treated for 2 years with the isoflavones. And also the results of our study are consistent with Risco and co-workers that showed that phytoestrogens combined with mixed exercise seem to be a better strategy than exercise alone to improve the general quality of life in obese women. So the strengths and limitations of the study stated by the author are strengths of this present study are the duration, the number of participants, and the little placebo effect due to the fact that women were enrolled and treated for their osteopenia and not for health status. As a matter of fact, no participant withdrew as a consequence of treatment inefficiency, so that's really cool. There are, however, also some limitations. The study population mean baseline scores of the questionnaire, consequently, the obtained increase in the questionnaire scores does not represent a significant clinical immediate improvement, but has instead a preventative implication and could longer preserve a satisfying quality of life in these subjects. So, hormone replacement therapy has a huge public health implication. This affects many women and all over the world, especially different cultures, because some cultures don't believe in using hormone replacement therapy at all and look down on other women that do use it. So it's interesting to see different cultures and how they respond to hormone replacement therapy. So since 1920s and 1930s, the United Kingdom and the U.S. epidemiological studies began to implicate endogenous sex hormones and breast cancer by detecting links between risk of breast cancer and women's reproductive history. So in the mid-20th century, concerns about the rise in coronary heart disease mortality occurring at an earlier age among men than women led to the presumption that endogenous sex hormones were key differences in women and men's cardiovascular health, and that use of estrogens might reduce the risk of cardiovascular disease. So this is where it began that, okay, hormone replacement therapy may be a huge benefit for women because it can reduce the risk of these diseases significantly. However, starting in the mid-1970s, some epidemiologists began questioning hormone replacement therapy's cardiovascular benefits, and in 2002, a huge study from the Women's Health Initiative showed how the use of hormone replacement therapy was bad for women and put them at more risk. So this scared a lot of people, and many women were pissed that the doctors were giving them these hormone replacement therapies knowing that there were risks behind it. So after that, there was kind of, people weren't really looking into it. It kind of like went off radar. It's starting to get picked up again. Today, it is still a gray area, and now doctors are weighing the benefits to the risk for each individual patient as opposed to looking at women as a whole. So the FDA recommends that hormone replacement therapy should be used in women that are experiencing severe menopausal symptoms. So these are like hot flashes, vaginal dryness, loss of sexuality, mood changes, and joint pain. But for the disease prevention part, the FDA still does not recommend hormone replacement therapy. So I found that very interesting, but very beneficial. So I'm only 22 years old, but it will be interesting to see where hormonal replacement therapy is when I reach that age, and if there are any new information and what I should be doing. Because even though I am young and I necessarily don't need to start looking into it, it's still important to know, especially as I become a nurse, because I'm going to be taking care of people that are going to question it, and I should be able to know it. So, thanks for listening.